Autosomal dominant polycystic kidney disease. What to know? First things first, kidney 101. So typically, a human is born with two kidneys that are located in the back of the body on either side of the rib cage. A healthy kidney is about the size of your fist, which is 5 inches long, 3 inches wide, 2 inches thick, weighing about 10 to 12 ounces. The kidneys are a vital part of your urinary tract system, responsible for filtering out the wastes of the body. Each kidney contains nearly 1 million tiny little filters called nephrons. And approximately 47 gallons of fluid pass through these filters of your kidneys each day. The fluid is made up of water, electrolytes, and other small substances. In a healthy kidney, this process allows kidneys to maintain the body's correct amount of fluid. And there's some hormones that our kidneys produce as well that are essential for things like regulating our blood pressure, handling the salts and potassium, and telling our bones to make more red blood cells. So, what is autosomal dominant polycystic kidney disease, or ADPKD? What does that look like for someone who has it? Well, it is a genetic disorder characterized by the growth of cysts in kidneys. These cysts can enlarge the kidneys and impair their function over time, leading to symptoms such as high blood pressure, abdominal pain, and eventually kidney failure. ADPKD is a painful condition that can significantly affect quality of life. Those with PKD have the potential to develop cysts on the liver, spleen, and pancreas. Individuals may also develop other complications such as mitral valve prolapse and intracranial aneurysms or brain aneurysms. This next slide will show you a picture of a healthy kidney compared to a PKD kidney. So here you have a healthy looking kidney and a very large cyst-filled kidney. Genetic factors. So when you see the autosomal, it means PKD gene resides on an autosome. An autosome is a chromosome not associated with male or female. Dominant means it takes only one inherited mutated gene to acquire the ailment that it is associated with. There is no carrier state with a dominant disease, and it doesn't skip a generation. Polycystic meaning many cysts. So geneticists have discovered two genes that are responsible for autosomal dominant polycystic kidney disease. There's PKD1 or PKD2. The gene may also have truncating variant, which is a genetic variant that results in a shorter version of the polycystin 1 and polycystin 2 protein being produced. The PKD1 with the truncating variant is associated with an early onset and more severe case of PKD. Those that have the PKD2 mutation, it's often much milder, and the disease is also known to show up much later in life. And people with PKD2 mutation are more likely to die from something other than the disease. About 20% of people diagnosed with ADPKD have no family history of the condition. This is called, they had a spontaneous mutation. But once someone has ADPKD, whether inherited or from a new mutation, there's a 50% chance that they will pass it on to each of their children. Again, it does not skip generations. So early warning signs, if you've decided to not be tested or if you have no family history, hypertension or high blood pressure, unexplained flank pain, or having blood in the urine, UTIs, kidney stones are all early symptoms and a reason to dig further into your kidney health. I was 16, went in for a physical, had high blood pressure. The doctor sent me in for several tests to discover that I had PKD. Because of my diagnosis, my brother and my father went in and were diagnosed, and my father was only 55 when he passed away due to complications with the PKD. So daily care, keeping healthy blood pressure is the first thing medical professionals want to see in PKD patients. Patients with PKD need to closely monitor their blood pressure at home and report any spikes in the numbers to your doctor. Doctors may need to adjust your medication. limit caffeine and sodium intake. Someone with PKD is already going to be battling hypertension. Caffeine will just add to the spike of blood pressure. And then extra salt makes your body hold on to water, increasing the volume of fluid in your blood vessels. The extra fluid forces your heart to pump harder, raising your blood pressure and putting severe stress on the delicate blood vessels in your kidneys. High sodium intake also stimulates the release of a hormone called vasopressin, which actively promotes the growth and enlargement of kidney cysts in ADPKD. So just drink water, right? So avoid dehydration is considered wise. In addition, generous water intake has a potential to suppress vasopressin production. So generous water intake also helps maintain a diluted urine and decreases the risk of kidney stones, which are increasingly seen in PKD patients. But as your kidney function deteriorates, generous water intake can be problematic and even dangerous. It's complicated and it's very individualized. So a patient must seek the advice of their nephrologist. Eating healthy. There's no specific diet out there that can make your kidneys better or keep them from getting worse if you have PKD. But just like with anything, PKD patients should eat a balanced and healthy diet to maintain optimal body condition. There are studies that have shown there are diets out there that will help with blood pressure issues, such as the DASH diet. So many doctors suggest that this diet be part of a PKD patient's life. There are other studies showing that high protein intake from animals, animal protein, can decline kidney function, while other studies have shown that there's no reason in lowering protein intake, but they will say just being aware of the amount of animal protein that you take in. Exercise, just like with anything, exercise, everybody needs exercise, but it's recommended that patients with PKD have a low impact exercise regimen, like yoga or swimming, body resistance training. Those are what's good. Anything that could have potential negative impact on your body, like tackle football or long distance running, is not advised. So on April 24th of 2018, the FDA approved a drug called tolvaptan to be used as treatment for people with PKD. Tolvaptan is a medication that affects how the kidneys control the concentration of urine. It has been shown to slow down the growth of kidney cysts when it is taken for a long time, like several years. This may help protect the function of the kidneys and delay the need for kidney transplant or dialysis. Kidney function will continue to decline, but at a much slower rate. To date, there is still no cure for polycystic kidney disease. However, a healthy lifestyle that promotes kidney health, along with regular visits with a nephrologist, a person with PKD can live a long life.